number of tumor cells in the peritoneum. The effect of interferon is almost within 24 hours, 48 hours. So that it is temporally before an immune response. I don't want to go into the mechanisms that we investigated when the tumor is injected intraperitoneally, but I'll come back. Would like to come back to what happens when the tumor is injected subcutaneously in reference to Professor Gajewski's remarks about the injection of interferon into the tumor. And many years ago, with Filippo's group, we investigated the effect of interferon, type 1 interferon. Everything I'm saying is about type 1 interferon. Type 1 interferon directly into the tumor. And we saw that this interferon produced a hemorrhagic necrosis. After the description of the hemorrhagic necrosis, we did some work with Harold Dvorak, who was at the Beth Israel at the time we did this work. And he found that by using thin sections, that the effect of interferon was on the endothelial cells of the, whether it was a direct effect of interferon or indirect through some other mediator, there was a destruction of the endothelial cells on the vessels that go into the tumor. These are very fragile vessels, and although interferon did not affect the endothelial cells of vessels that were far away from the tumor, it did destroy the endothelial cells of these fragile vessels that were invading the tumor. Now, what is, at first glance at these various anti-tumor substances, there would seem to be no common denominator, and yet there in some instances there is a common denominator. Cyclophosphamide, for example, although it has direct effects on the tumor, probably has major effects on the immune system. And Sala and his colleagues, Sala working here in the Institute, showed more than 20 years ago that even though the monoclonal antibodies that were used against friend cells had direct in vitro cytotoxic effects, there was a necessity for an intact immune system, so that the effect was really dependent on the immune system. And I think the next slide, could you show the next slide? I think two very surprising, at least to me, observations in the past few years has been that local radiotherapy that is thought to have exerted its anti-tumor effect because of effects on DNA actually seem to be dependent on type 1 interferon, and monoclonal antibody, as shown by Stagg and his colleagues, is also dependent on interferon type 1. And I was going to ask in the text that I had prepared whether other chemotherapeutic agents also induced interferon. And because we know that from the work of Proietti and his colleagues that cyclophosphamide induces interferon and probably is required for the action of cyclophosphamide. And I wondered actually whether surgery even, extensive surgery might induce interferon. And I don't know whether it was mentioned whether anti-angiogenetic factors also induce interferon. I've talked about the giving interferon and inducing interferon, and Filippo talked about endogenous interferon, and I just want to mention the Veglio Bocci emphasized for many years the importance of endogenous interferon, which he called physiologic interferon. And Filippo and I were interested in what happens if you neutralize this endogenous interferon by injecting a potent antibody to interferon. And there are a number of physiologic responses that are changed, the behavior of macrophages. It was said that many viruses cannot multiply in macrophages, that there's an inherent capacity of macrophages to reject the multiplication of, if I can use the word reject, or not permit. But we found, or Filippo found, that inoculation of antibody to endogenous interferon 4 days previous to harvesting the peritoneal macrophages, just the injection of the antibody to interferon, and then 4 days later harvested the peritoneal macrophages, and they were permissive for a whole variety of viruses. So there are physiologic changes. Also, Le Bon showed that the levels of IgG in the normal mice are changed by the inoculation of antibody. And the example that Filippo gave of our work of inoculating antibody and then giving transplantable tumor cells, he showed a slide of in a syngeneic system, friend cells, where the cells multiply more rapidly. However, we also showed that the allogeneic tumor cells grow markedly and kill the mice, whereas in normal mice, they are rejected. And not only allogeneic tumor cells grow, but even with Barry Bloom, we showed that xenogeneic, and he used human prostate cells grew in mice that were treated with antibody to interferon. And I would be interested in doing normal skin grafts, but I didn't think of it at the time. But it would be interesting to know what the effect would have been. Anyway, these ensemble results suggest that interferon type 1 is the kingpin of the host anti-tumor resistance. I would like now to go on to the second topic and consider the possibility that type 1 interferon can be pathogenic for man. In the mid-1970s, we described a syndrome that if you give potent interferon preparations to suckling mice, they develop a syndrome which consists of delayed growth, and this occurs in the first week of life. Potent preparation of interferon, delayed growth, a liver necrosis. The liver sort of falls apart, and the best of pathologists looking at these slides have never come up with an explanation. And all the suckling mice die. If you stop the experiment sort of at the 6th day of life, where there's perhaps 5% of mortality, then the mice appear to recover and they grow, but several months later, they develop a progressive and lethal glomerulonephritis. So this was a syndrome that was seen in suckling mice and suckling rats. And we knew at the time that exactly the same syndrome occurred if you inject lymphocytic choriomeningitis virus. This is not lymphocytic choriomeningitis virus in adult mice, this is in newborn. And so the problem we had at the time was, is it the interferon that we give that enhances the lymphocytic virus that might be latent, or when you inject lymphocytic choriomeningitis virus, LCM, it induces a lot of interferon. And in fact, it's the latter hypothesis that was correct. The injection of suckling of newborn mice with LCM virus produced a lot of interferon, and you had the same syndrome. So then the question came, if you give antibody to interferon, what will happen to mice that are injected with LCM virus? Well, this antibody is a neutralizing antibody. It neutralized the interferon that was induced. The virus multiplied 100-fold more, but despite the increase in virus titer, there was a delay or a complete abolition of the syndrome. The mice grew normally. The incidence of death was decreased, as was the later development of glomerulonephritis. So we showed that so paradoxically, we were treating a viral disease with antibody to interferon, and we hypothesized at the time that some effects of viral infection in utero may be due to the interferon induced in the mother or the embryo, and only becomes manifest later in life, and furthermore that in some instances interferon may also cause or contribute to human pathology. And now I come to the next slide, please. Now I come to the part that Sandra Pellegrini covered this morning, and there's one point though that I want to stress that. I'm sorry. Can you get it back? Yeah. The first observation in time that in lupus erythematosus, that there was a leukocyte interferon is the work of Skirkovich and Eremkina in 1975. They also used a antibody to interferon. They made it in donkeys, and they had the temerity to inject that into patients. And there are very few details given, but they said that it was effective. And as you know, I've listed in the more recent dates, there are trials now to show whether monoclonal antibodies to interferon alpha or the receptor or strategy designed to block interferon alpha produced by plasmacytoid dendritic cells will have an effect. Can I have the next slide, please? And again, as Sandra said this morning, in the Cardi-Goutier syndrome, Pierre Lebon was the first to show that there is a interferon alpha in the spinal fluid and blood of infants. And he suggested that it was due to a possible genetic defect in the regulation of interferon alpha synthesis. And I forgot to mention that as Sandra also said, that Yannick Crow used the term interferonopathies for these diseases in which there is a constant production of interferon. And I won't go into the details, but you can see in the last column the clinical manifestations. So there's a constant production. And more recently, Yannick Crow and his collaborators have shown that in the Cardi-Goutier syndrome is associated with mutations in any one of 6 genes, I believe she mentioned that, encoding repair exonucleases. And as a result, endogenous nucleic acids accumulate within the cell, inducing the synthesis of interferon alpha. The next slide. And there is a third disease which also is associated spondyloenchondrodysplasia with an increased expression of interferon alpha. The question then, although Sandra said this morning that this was evidence that interferon was pathogenic, my own, for the moment, I'm more cautious. Maybe incorrectly so, but it seems to me that for the moment, we don't really know whether this interferon is the result and coincidental with the pathology or whether it is actually an etiologic factor. And I think it will be certainly worth trying to suppress the interferon alpha production, neutralize its activity as we did in mice, to determine whether these measures can affect the evolution of these diseases. I mean, it's a very important point to see whether it's the correlation, whether it's just a correlation or whether interferon is really an interferonopathy. I want to conclude with just one general remark. For many years after its discovery, interferon was considered exclusively an antiviral factor. It was then found to have pleiotropic effects on cells, and now its interaction with the immune system seems paramount. And perhaps we haven't yet found its true raison d'être. And perhaps there are effects on the nervous system, the central nervous system, or some other crucial system that haven't been thoroughly investigated. And there was a famous Hungarian scientist who said, research means going out, called St. Georgi. He said, research means going out into the unknown. And I think there are still plenty of unknowns in interferon research. Thank you very much.